Hi, I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. When I started our clinic back in 2017, I wanted to do things differently than standard hearing aid clinics. So instead of offering a free basic hearing test with a one-size-fits-all hearing aid recommendation, I decided to step out of the box and charge for a much more comprehensive 2-hour consultation with best practice audiologic evaluation and individualized hearing aid recommendation. You see, in order for us to get an in-depth understanding of all of your hearing difficulties and your top hearing priorities, and complete an in-depth hearing evaluation with a variety of additional diagnostic tests to get a complete understanding of your audiologic system, with enough time to review all of these results with you in detail and give you a recommendation on the best hearing aid treatment option for you, we realized that we needed to spend significantly more time with every single one of our patients. We call this our Applied360 Discover consultation. It starts with our initial case history to uncover any red flags that would require a medical referral, as well as to uncover any and all hearing situations that you find difficulty with. Not only does this require a careful evaluation of all the areas that you find to be difficult, but it also helps to have the perspective of a significant other, like a family member or friend, to gain their perspective on where you're having hearing difficulties. This is also where we identify your top priorities when it comes to your hearing, because every good hearing treatment should start with what's most important to you. Once we have this detailed understanding of your hearing history, we can move on to a physical examination of your ears. If necessary, we will carefully and safely remove any and all earwax from your ears so it doesn't interfere with your hearing test, and in some cases, your entire hearing loss is due to just impacted wax inside of your ear canals. Once we ensure that your ears are clear, we can move on to your comprehensive hearing evaluation. This includes an ear pressure test called tympanometry if you're experiencing any ear fullness or if we suspect that your outer or middle ear is contributing to your hearing loss. We then progress through air conduction and bone conduction testing, as well as speech understanding in quiet and speech understanding in noise. We also measure your uncomfortable listening level so we can identify the dynamic range of your hearing, which is very important when it comes to actually treating your hearing loss. Once we have all of this audiologic information, we will review it with you in detail in a way that is easy for you to understand. Having a good understanding of your hearing loss really helps you better understand what's causing your hearing difficulties. Once you and your doctor have a good understanding of your hearing loss, it is time for us to move on to your treatment recommendation phase. This is where we will discuss your best treatment options, which may include consideration of a surgical procedure if you're having a medical cause of your hearing loss, hearing aids, which for most people is the most common recommendation, or even consideration of a cochlear implant candidacy evaluation if hearing aids are not a good treatment option for you. Not only is it important for you to have a good understanding of your hearing loss, but it is also very important for you to have a good understanding of your best treatment option and why. If hearing aids are your best and only treatment option, we will spend additional time to identify all of the different features and capabilities of all of the currently available hearing aids that would be ideal for treating your hearing loss. We work with all of the major hearing aid brands, so we can guarantee that we can find the best hearing aids for you. Once we identify the ideal hearing aids for your hearing loss, we'll spend some time to discuss our Applied360 Fit best practice fitting sequence. Because not only is it important for us to identify the best hearing aids for you, we actually have to fit and program those hearing aids in a way that you're able to receive the maximum amount of benefit from those devices. One thing that every single one of our patients tells us after they've gone through their Applied360 Discover consultation is that it is the most in-depth and detailed consultation that they have ever had anywhere. But if we're going to achieve our #1 goal of helping you hear your absolute best, this is time that is very well spent. If you'd like to see for yourself the difference that our Applied360 Discover consultation makes, feel free to check out all of our 5-star patient reviews and testimonials on Google and our website. But if you want to experience this difference for yourself, feel free to send us a message or give us a call to schedule your Applied360 Discover consultation today.